You're probably wondering what you're doing here, and I'm perfectly fine. Tuesday night, there's probably lots to watch on TV and that kind of thing. But the reason we want you guys to come, go ahead, Scott, is because part of my mission is that I don't just want to throw you guys a fish, but I want to teach you how to fish on your own, and that I want you to become good healthcare consumers. And part of that process is understanding more and learning more. So that's why you're here tonight. And we're doing recording. It's not normal to do recording, but we're going to get a CD for stragglers who can't make it. We can just send them home with the tape, and they can watch the class. It's that important. So guys, tell me, just by show of hands, who wants to be healthy? Who's that important to? Okay, that's reasonable. And I think most people say they want to be healthy. That's a good answer. But I think that if you want to be healthy, we should be able to define health. So what is health? What is health? Physical, mental. It's part of it, you bet. So what does it mean to be healthy?
Not have problems.
Like no problems. Yeah. Like what? What kind of no problems?
Like back problems. Or
like no
physical problems.
Okay, no pain, no sickness. Okay, basically no problems. All right. And I want you to know that these are my most common answers. This is what I get the most. People say, it's not having any pain and it's not being sick. And my response is, well, okay, that's reasonable. And I don't think none of us want to have those things. But the answer is no. Kind of set you up for that one. That's not what health is. But health is it's more than that. The World Health Organization defines health as this. They say that that health is an optimum state of mental, physical, and social well-being. It's not just the absence of disease or infirmity. So it's not just not having pain. It's not just not being sick. It's about expressing full health potential at 100%. Does that make sense? Big difference there between not having pain and actually being as healthy as you can be. So let me just give you some examples of that. Let's just say if you base your health on how you feel, it can be a very dangerous thing. And let me give you some examples. Breast cancer. Did you guys know that breast cancer can exist on a cellular level in the breast for 7 years before they can actually detect it? 7 years. Another good example is high blood pressure. It's known as the silent killer. And how many people do you know that can know when their high blood pressure is up? Very few. But it's not something you feel, but you can measure it and go, oh, you got some problems. Let's bring that down. It's an indicator of health. Another big example is a lot of people, the first sign of heart attack for most folks is death. Like they don't even know it and all of a sudden they're dead. But let me ask you a question about heart attacks. If you just have a heart attack one morning, did the heart attack begin that day? Or was that health disease a process in the making for the past 20 years? Yeah, kind of makes sense, huh? So health is a process. It's not an event. But we in America, we tend to treat it eventful. Oops, I hurt myself. Oops, I got a heart attack. So now let me give you an opposite extreme here. Here's another guy, a young guy, and he's commuting. He's in college. He's commuting from Salem, Oregon every day over to Portland, Oregon. And one day, it's like 95 degrees in summertime, he brings a chicken and mayonnaise sandwich. And he leaves it in the car. And so at lunch, he's looking for a sandwich, and I can't find it. So that day, he has some hot lunch. 5 o'clock rolls around, school's out. He gets back into his car, and I found my sandwich. And he picks it up, and he eats it. What happens to that guy?
He gets very sick.
Pulls over quickly.
Pulls over quickly, that's right. So he gets sick. What are some of the symptoms you get when you have food poisoning? Vomiting. Stomach cramps. Okay. What else? Sweat. Okay. Fever. Get a fever. Body aches. I mean, it just sucks. There's nothing fun about having food poisoning. But let me ask you a question. And by the way, it's a true story. This is my experience. I was young and dumb at the time. But let's just say, this person, was he sick? Was I sick? Or was it a healthy body's response to an invasion by a pathogen? What's that?
The latter.
The latter. Okay. Why on earth does our body vomit? What's the point of that?
To get whatever's in out.
To get whatever is in out. That's right. So our body has an intent for that symptom. There's a reason for it. But what is our first response as Americans? What do we do when we have vomiting? What are you going to do if you start vomiting?
Find a safe place to vomit.
I like that. Find a safe place to vomit. Step one. That's good. I've never gotten that answer. But most people are going to run to the medicine cabinet and they're going to find some anti-vomiting medication, right? We're going to find some Pepto-Bismol or whatever it is that will prevent you from vomiting. But what are we really doing when we do that?
Hiding the problem.
We're just hiding the problem. We're fighting against our body's innate capabilities to get this bacteria out of our body. Now, what do we do about the diarrhea? Same thing. Open the medicine cabinet, you find something magical, and we swallow it. But why is our body having diarrhea? Tell me about that one. Why does our body have diarrhea?
From something we ate, or if we're sick or not well.
Mm-hmm. It's trying to get it out. So our body is very innately intelligent. It's very capable. And when it senses that bacteria, the colon starts to spasm and it gets it out of there. It doesn't allow any water to be uptake, and that's why it's diarrhea. It gets out. So there's a purpose behind that. And we are taking the medicine and suppressing that innate response. Now, how about fevers? Why do we get a fever when we get sick?
It's a natural reaction.
It's a natural reaction.
Fight off any-
Okay, to fight it off. So when your body has a high temperature, what happens is that your immune system is mobilized, becomes stronger and more active. Fevers are very healthy. You want to have a fever if you're sick. And by the way, in a hot environment, bacteria become very weak. They don't do so well. They can't multiply as much and they become less active. So our body's creating an imbalance so the white blood cells, our immune system, can fight off these bacteria. It's a good thing to have. But our educated brain says, ooh, health is having no pain and not being sick. So I need to take some kind of drug to suppress that fever so that I feel good. Because in our country, we just want to feel good. It's all about just feeling good. You feel fine, you must be okay. You mimic health, you must be fine. It's about suppressing symptoms and not necessarily expressing optimum health. Anyway, by the way, guys, a little piece of trivia for you here. Did you know that if you take some kind of fever reducer while you're sick, it actually prolongs it an average of 3 to 4 days, makes it last longer? Did you know that? It's counterintuitive because most people think, well, I'm feeling good. But in reality is your body has to fight off that Tylenol now, because Tylenol is very toxic for the liver, for example. And without that fever, it doesn't fight it off as well, so you prolong it. By leaving it alone, let your body doing its own work, it will overcome it quicker and more efficiently. And you develop a stronger, more well-trained immune system over time. So anyway, I bring that example up because here's a person with a heart attack that is seemingly healthy, but all of a sudden dies of a heart attack and finds out he was sick, but he felt great. And here's a guy that felt crappy because he ingested salmonella, but was very healthy. It was a very healthy response to do what he did. And in the end, I was fine. Okay, I ended up surviving and I lived. My body did an appropriate thing. So I hope you understand at this point in the class that health is not just feeling good. It's about expressing optimum health. Okay. Now, next portion of the class. What is our current healthcare system? What is it?
Broken.
It's broken. That's a good response. Okay.
Do drugs.
You do drugs. That's right. It's very much about adding chemicals to your body or subtracting organs from your body. It kind of boils down to that. Our system is a symptom-fighting system. It's a crisis system. And I want to talk about the system quite a bit because there's a lot of shortcomings about this system. I'm going to back this away a little bit so everyone can see a little better. Okay. So our current healthcare system is, you said broken, but it's called Western medicine, right? Allopathic medicine. And there's a lot of statistics you should know about it. And in medicine, the way we get our information is through scientific journals. We spread journals around, and that's where we get it from. And so this journal right here is called the American Journal of Medicine. And they wanted to find out, in 14 of the most common symptoms, how good is medicine at finding the cause. And so what they found is that 74% of the time, we don't know. This study was done at the Mayo Clinic. This is where you got the best diagnosticians in the world. And 74% of the time, they couldn't find out what the problem was in this study. Okay, 10% of the time, they thought that it was psychological. Patricia, you really don't feel that way. I think it's all in your head. Try this Prozac. I mean, that kind of thing happens all the time. This is a true story. I have a patient who's been coming to me for several years now. And when I first saw her, she was having back pain. And I'm taking a history on her. And she's telling me that she has this back pain. I said, okay, fine. What are you doing for it? Taking Prozac. Really? Well, tell me about that. She goes, well, I went to the doctor, and he said I must be depressed, and that's why I'm having back pain. He gave me Prozac. I said, okay, so are you depressed? She says, no. You stressed out? No? Okay. How long have you been on Prozac for? About a year. Is it helping? No. Still got back pain? Yeah. I mean, but that's actually what they think sometimes, that it's psychological. 16% of the time, they actually found an organic cause. They actually knew what the problem was. 16% of the time. So now I'm not saying this because I'm a great diagnostician, by the way, because I'm not. It's a very difficult thing to do. But I'm just throwing it out on the table saying, look, we always don't know what's going on. But how often do you go to the doctor and not come home with the prescription in your hands?
They're drug salesmen.
They're pretty much drug technicians. That's right. So the point is that we really don't know what's going on in medicine all the time, but we're still throwing drugs out there quite a bit. Moving on. This study was done in the Journal of American Medical Association, probably the most prestigious journal in medicine in the world. And this was done back in 1994, and they found that 20% of the patients that were admitted to university hospitals, and by the way, university hospitals are the best of the best. This is not St. Alice or St. Luke's, but if they can't figure it out here, they're sending you down to the University of Utah because they got a conglomeration of a lot of really good doctors there. And even though it's a good hospital, 20% of those that are admitted to university hospitals end up suffering what's called iatrogenic injury. You guys know what that is? Iatrogenic. Iatro means physician, and genic means created. So it's basically medical error. It's malpractice. It's the oops factor. 20% of those that go to the hospital will be injured by the doctor. This is a huge study, folks. That means 1 out of every 5 that walk into the hospital will leave with an injury. Moving on. At the bottom here, 180,000 people die every year as a result of medical malpractice, medical errors. 180,000 people a year. That's the equivalent of 3 full 747 jumbo jet crashes every 2 days. That's a lot of people. Now, if the airline industry was that bad, I wouldn't be flying. That's a lot of deaths every year. But by the way, this is an old study. This was done back in 1994. They redid this study back in 2001. And guess what they found?
Higher death ratio.
A higher death ratio. What do you think it was? It was doubled. In fact, it was a little more than double. It was 425,000 people a year, according to the 2001 study, and that was in the same journal, the Journal of the American Medical Association. Okay, I'm not just making this stuff up. They did this study again back in 2004. Not this year anymore, last year, 2004. Back in, I think it was March. It was early part of the year. They redid this study. And guess what the number's up to now? 2004. Medical deaths.
Above 500,000.
It's above 500,000. It's now 783,000 people a year. That officially makes medical errors the leading cause of death, more than heart disease, more than stroke, more than cancer. I mean, it's an unacceptable system. And it's not that I think that, well, let's move on. I'll go to that in a second. Okay, moving on. The elderly are particularly at risk. Most of our elderly population are taking a handful of drugs every day. And the problem is that you get these specialists that aren't paying attention to what the nephrologists give them, and they're the cardiologists, and you get these interactions, and you die. And the studies that are shown here is that 51% of all deaths in the elderly are from drug reactions. That's more than half of our entire elderly population is dying from the drugs they're taking, not from the disease they have. So the old adage that the cure is worse than the disease is kind of true. Good to know. Okay, moving on. Let's see. This right here, this one just says annual total drug-related problems. It accounts for 28% of all hospital admissions. A study showed that 28% of the people that go to the hospital are there because of some kind of drug they took that the doctor prescribed to them. That's almost a third of their business is what they're prescribing. I mean, it's just, and this is the American Medical News right here. The problem that I really, really have with medications is that if you introduce a drug into your body, that drug doesn't magically just go to your toe and then fix the toe pain, or just go to your nose and take care of the runny nose. But that drug circulates through every single cell in your entire body will be exposed to that drug. And at every given nanosecond, you got 100 trillion cells in your body. In any given nanosecond, each cell has about 200,000 biochemical reactions taking place. And you introduce a foreign chemical to those reactions, and you start to get other reactions that shouldn't be there. They're called side effects. And side effects are very dangerous. In fact, did you know that 20% of all drugs that are approved by the FDA, 20% of all drugs that are on the market right now, will be taken off the shelf within 10 to 20 years because they're found to be too dangerous. And right now, there's a whole string of it. We heard about Vioxx. You guys remember Vioxx a couple months ago? And then the Celebrex.
5 years.
You took it for 5 years? Well, here's the problem with Vioxx is that they're finding that it's causing heart problems. But they've known for years that it causes stomach problems. So anyway, so they took Vioxx and then Celebrex, and now we've got naproxen and we've got Advil. I mean, all these drugs are fit into a class of drugs called NSAIDs, non-steroidal anti-inflammatory drugs. This class of drugs, not including heart problems, kills 20,000 people a year from bleeding ulcers. You're not taking it for your stomach, but it affects your stomach. It's called a side effect. Anyway, moving on. What this study shows is that in 1994, Americans spent $73 billion on prescription drugs. That's a big number. But listen to this. They spent another $76 billion in extra medical costs dealing with the side effects. We spent $3 billion more than we did on the original drugs themselves. And that was years ago. And now, believe me, there's a lot more drugs out there. Because in 1996, they allowed the drug companies to market directly to the consumer for prescription drugs, too. And so these rates are even worse. Moving on, yeah, I could talk about that. I could talk about that. Guys, I could talk about a lot more of these things. But here's the deal. Do you guys think that I'm anti-medicine based on all this stuff I'm talking about tonight? You don't think so? Okay.
Prescription drug medicine or?
Just anti-medicine as an organization, as a whole. Just curious. Kind of sounds like it, okay. Yeah. That's usually what I get. Yeah, you're way against, but I'm really not anti-medicine. What I am is I'm anti-medicine when it comes to healthcare because it is not healthcare. It's not. I'm for medicine. I'm pro-medicine when it comes to crisis care, to disease care, because that's what it is. And I wouldn't want to be in a society that didn't have this system in place. We have to have it. In other words, if I'm tobogganing with my kids, we had a little accident this weekend. Did I tell you about that? It could have been really ugly, but anyway. Let's just say that I broke my leg and I had a big bone sticking out of my leg, compound fracture. Well, the last place I'm going to is a chiropractor, okay? I'm going to find the best surgeon in town, and he's probably going to give me some drugs, he's going to do some surgery. We have to have that system in place. But when we use it as health care, that's when these things start to occur, okay? Okay, so the next question is, what exactly is health care then? Where do you get your health?
The way you live.
The way you live. Great. The way you diet. All right, good. So someone said diet. Who said that? Nice answer. What else?
Genetics.
What's that?
With genetics and like DNA from like your parents and everything.
Okay, we are genetics, right? But we're talking about lifestyle choices that he was talking about, right? Isn't that what you said? Lifestyle choices. So you can't really choose your genetics. You kind of got them.
Yeah.
So what else we got?
Sleep.
Excellent. Sleep. I know Scott's got some. He's a smart guy.
Pull him back. Go and take the crowd over.
It's exercise.
Exercise, good. By the way, guys, I got horrible handwriting. I'm doing my best to write as good as I can. Okay, what else? Looking for one more. This is a toughie. I'll just write it out for you. P. Any guesses yet? Psychological? Okay, good. I'm going to write PMA. And PMA means positive mental attitude. Psychological. Okay, mental. Your mental input, guys. Let me just talk about this for a second. 20 years ago, if I was up here telling you that your positive attitude would affect your health, I would be called a quack, and that was crazy, and you have no evidence and all this kind of stuff. And now, the evidence is indisputable. I mean, there's tons of research out there showing that what you put in is what you get out. And the mind-body connection is no longer even argued. It's accepted as self-evident. One of the best studies I've seen on this is a study that began back in 1969. And they took like 30,000 college-age students in America, and they had them fill out surveys based on, are you an optimistic person or are you a pessimistic person? And they wanted to just kind of find out who they were. Well, they left them alone after that. And you guys know what optimism and pessimism is, right? Know the difference there. So 30 years later, back in 1999, they caught up with this crowd, and they wanted to find out, well, how is your health? How's your health? And they divided them up into groups, and basically the pessimistic group, the group that generally saw the glass half empty, the negative thinkers, everything's negative, that group had twice the cancer rates, chronic illness rates, death rates, depression, suicide. I mean, it was across the board a very unhealthy group. And the positive group, more happy, more successful, less sick, living longer, etc. So it's just so important. And there's other studies showing if you laugh, you get immune boosts, and you get to the hospital sooner, and there's a whole lot more. Exercise. Exercise is one of those things that we could give a whole semester on this, and you can't get enough. But there are volumes and stacks of volumes of information on how exercise is beneficial for your health. In fact, there's not any part of your health that's not affected by exercise. It's so healthy for you. And if I give you some guidelines on that, if you're not, how many people are exercising right now, just by show of hands? 2 takers, okay. You're building a home, so I know that's kind of some work.
Yeah, I mean,
So exercise, if all you guys did was walk briskly for 30 minutes 3 times a week, if that's all you did, you'd be prolonging your life, decreasing your cancer rates, increasing your energy, your metabolism. I mean, there's so many things that can happen from just that alone. So exercise is huge. It's preventive. Moving on. And I think that you should do some strength training. I'm not saying that's it, but if I want to be here as a consultant for you guys, and I have all kinds of information on exercise, we should talk about it at some point on an individual basis. But you got it. That's a big part of them. Sleep. This is one of those things that the research says you've got to have between 6 and 10 hours of sleep. That's about what we need to be healthy. And everyone's going to be a little different. I do well with about 6.5, 7. My wife needs more like 10 or 12. She's a kitten and can sleep anywhere, anytime. She's purrs. So it varies. You've got to have good, uninterrupted sleep. Diet. And again, I could be given multiple classes on just this subject alone. But there's some principles you should know about. One, you got to have lots of water. 70, I don't want to say the wrong stat, but 70-something% of Americans are chronically dehydrated. We're not getting enough water. Instead, not you? Are you a water chugger?
10 glasses a day or more.
Good for you. Awesome. That's great. And you'd be healthy, a lot healthier for that. We need to have water. A lot of Americans replace water with stuff that takes water out of us, like pop, coffee. All the caffeine and the sugar full, all the stuff, the crap that's in there.
It's too sweet.
Is that right? Yeah.
I'd rather have an ice cold glass of water every day.
So, I would too. I'm a big water fan. But okay, so lots of water is good. With your diet, there's so many fad diets out there, guys. There's the Atkins diet, and there's the South Beach diet, and there's the no-fat diet, and there's so many extremes out there. And I've been around. I'm relatively young, but I've spent my life studying health, and I've been around long enough to know that there's a lot of extremes, but balance is the key. If you balance the types of calories that you intake, if you get enough fat, you get enough protein, you get enough carbs, and the right kind of carbs, then you're going to be generally healthy from that. You want to eat foods that are not going to make your insulin levels skyrocket. Like, don't just have a big burst of sugar, because not only will that suppress your immune system, but it makes your insulin go up and then down, which affects all other chemicals in your body. So have a little bit of fat and protein with your meals, along with the carbohydrates. Eat less processed foods is a huge one. There's so many foods out there that are full of additives, preservatives, artificial flavors and colors. And what happens is that these chemicals are causing disease because we're ingesting them chronically over time. When you shop at the grocery store, if you stick to the outside aisles, you're generally shopping right. If you're on the inside aisles, where you got all the stuff like the aspartame and the hydrogenated oils and the trans fatty acids and the MSG and all these chemicals they put in the food to beef up the flavor and the shelf life, well, it's affecting your health. So if you're getting the dairy and you're getting the vegetables and the fruit and the grains and the meats, you're generally and you've got raw food that you're cooking that can actually perish over the next couple of weeks, that's what you should be eating. So just word to the wise on that. And by the way, guys, if you're not taking a multivitamin, you should be. We're not getting enough nutrition in our diet. Again, that's something you should all be doing. And I want to be, again, a consultant for you guys. I have expert knowledge in nutrition, and come to me and ask me, and I'd love to answer your individual questions on this kind of things. Okay?
Question on sleep.
Yes?
Does it matter the time that you sleep? Well, I heard that the earlier you go to bed, the better the sleep is or something.
That's true. Your body has certain chemicals that are calibrating it during certain times of the day. And if you kind of look at it from an evolutionary standpoint, I'm not a big evolutionist, but I'm just saying that our bodies do adapt. And what happens is that we're used to sleeping at night, and now we have TV and we have all these things. And this is a recent phenomenon over the last 100 years. Before then, everyone was in bed a couple hours after the sun went down. You didn't stay up too much longer. And so our body does a lot of replenishing at that time. So yeah, you should go to bed earlier in general. All right. So, okay, guys, all these things are very important. You guys can know the answers, and they're good answers. And they're very important. But I want to take it back a step and go back to my original question. Where do we get health? Where does health come from? And it does come from lifestyle. It really does. But health comes from another place. Where does it come from? Where do you get it at?
Inherited?
You inherit it. Okay, genetics are important.
Yeah.
But what are you inheriting exactly?
State of mind.
Okay.
Code.
Code? All right. Well, let me tell you about life. Let me tell you about life. Health comes from within. It comes from right here. And so many Americans are really sold on the idea and the concept that health comes from out there. It comes from without, not from within. And that couldn't be further from the truth. The reality is that we're born with it. It's given to us. We have it. Health comes from what chiropractors call innate intelligence. And I'm just going to write that word down for a second here. Innate. How's my handwriting, guys? Not too bad? That says innate intelligence. So innate intelligence, what on earth is that? Well, let me tell you about that. Innate intelligence is what creates and what sustains life. It's what organizes everything that happens inside of us. Okay. In other words, let's just say that if I go to the store and I'm eating a sandwich and I buy the sandwich, I'm eating it and I swallow it. Once it passes right about here and it goes into my digestive system, it's no longer in my control. I'm not controlling it anymore. Innate intelligence takes over. And it goes into your stomach. In your stomach, you got all these gastric juices that start to come out, and they start to break that sandwich down. And then it will go through your pyloric sphincter and it goes into your duodenum. And your duodenum, you got other cells who have certain jobs. And like, for example, one of the cells' job is to take a sugar molecule. It'll grab that sugar molecule and it'll pass it off into a second cell that will then hand it off into the bloodstream. Okay, that's cool. Like, well, how do those cells know exactly what to do and where to put that sugar molecule and where to get the molecule from? Well, that's innate intelligence. And then that sugar molecule goes through the bloodstream to every single cell in our body. And then once it goes into the cell, it's turned into energy. And it creates more cells, and it turns into eyeball tissue from eating a sandwich. The smartest scientists in the world couldn't take a sandwich and turn it into an eyeball. But our body's innate intelligence can do that. It's organizing this intelligence and creating who we are. It's awesome. Now, here's a really good example, too. Let's just say that you guys conspired and you said, let's hang the chiropractor, and you guys hung me. And by the way, when you die from hanging, what's the cause of death there? Why do you die from being hung? No, it's not suffocation, strangulation. If you're lucky, it's not strangulation, but it can be strangulation. It breaks the neck, that's right. And when you break the neck, what happens? You basically sever the spinal cord, and you no longer have any brain-body connection, and you're instantly dead. Okay, that's what you die from. But let's just say that I was alive, and before I was alive, we cut my arm, and we want to see what would happen. And what would happen eventually? It'll bleed, okay, and then eventually it'll start to clot, and pretty soon it's going to scar, and pretty soon, a couple weeks later, you can't even tell that I was cut. It just heals up. Well, that innate intelligence is healing my body. It knows how to do it. Now, let's just say that you guys then hung me, and you conspired and said, let's see what happens, and you cut my arm, and you waited and you watched. Well, what's going to happen to the cut?
Might clot a little and then not heal.
You're dead.
Yeah,
Oh,
I'm dead.
oh.
It's not going to bleed. It's not going to clot. It's not going to heal. Eventually, I'm just going to rot. But there's no healing. So if people say that the body heals, it's not true, because my body's right there and it ain't healing. Innate intelligence is the energy, the life force within the body that makes it heal. Do you guys see what I'm saying now? So there is a drive behind the cells that make the cells do what they do to create that health and that life. Same bag of chemicals, same organs, same tissues, same cells, different result because it doesn't have innate intelligence. The brain is no longer talking to the body. And if the brain ain't talking to the body, health ain't happening. There's no longer innate intelligence flowing through the body. So let's talk about that for a minute. Innate intelligence is distributed by the nervous system. I'm just going to do a little drawing of a brain right here. And this is probably not a very good drawing. There's the brain. It comes down and it has a little spinal cord right here. Okay. And you got little nerves that come off of the spinal cord, and they go to every single cell and organ and tissue in the entire body. There's not one cell in your body that's not getting communication from the nervous system on a regular basis to keep it informed and give it that flow of innate intelligence. Now, by the way, your spinal cord is completely encased by bone to protect those nerves. Very important. And what happens is that life happens. And you can accumulate stresses and traumas that will eventually misalign some vertebra, and that can kink off those nerves right there. Well, we're not talking about a severance of the spinal cord like in the case of being hung, because that's instant death. We're talking about something slow where the force with that nerve flow right here becomes decreased. And by the way, what is that called right there? We'll see how well you guys listen when I talk to you every day and you get your adjustments. What's that?
Subluxation.
Subluxation. Good man. Subluxation. Someone's been listening, Scott. So subluxation, guys. That's it right there. That cuts off that nerve supply, and then you can no longer be healthy. I would not want to be the organ at the end of that nerve right there. Okay. And by the way, how do you get subluxation? How do you get that thing that cuts off that nerve energy? Where do you get subluxations from? Well, it is a misalignment by definition, but how do you attain one of those?
Auto accident, stress.
You said a magic word right there. He said stress. Very good answer. He said stress. And stress is the only cause of subluxation. That's it. And where does stress come from? Physical stress. He said auto accidents. That would be a physical stress. Okay? What kind of physical stresses do we have? Auto accidents. What else do we have?
Repetitive movements.
Thank you. That guy, how old are you?
17.
17 years old. You should be a chiropractor someday. Repetitive stress is that is the disease of the latter day. Right now, that's what everyone has. Because in the old days, we used to go out and we used to, to hunt mammoths and that kind of thing. And now we're sitting in the desk, working on the computer, and we're just doing stuff like this all day. And you get these repetitive motions. And eventually, it's causing subluxation. And we weren't designed to sit like this all day. Lots of stress that over time will subluxate you. Good. I think that one of the biggest stresses that most people will encounter in a lifetime is the process of being born. Just being born in and of itself is a very stressful event. Does that make sense? Now, women are like, okay, that can make sense. And guys are like, what is he talking about? Well, let me explain it for a minute. You got a baby's head that's this big, okay? And it's being pushed through a birth canal that's very small by one of the most powerful organs in the body, and it's pushing it through. And kids come through, and often kids come out with their nose pushed over to the side. They got misshaped heads, broken collarbones, bruising. And a lot of kids come out with neck trauma, very often with neck trauma. And now they got suction, they got forceps. And here's another piece of morbid trivia. I apologize for this. But did you know, well, okay, you didn't know, but it takes between excuse me, it takes 120 pounds of pressure to decapitate an infant. 120 pounds of pressure. When they use forceps or when they use suction on a baby to help get it out quicker, it causes between 90 and 110 pounds of pressure. It's a lot of pressure. And believe me, they know how much pressure what it will be to hurt the baby, so they're very careful on that. But it's still a lot of pressure. So kids come out, and in America, 50,000 kids are die every year from the birth process. Just through being born in and of itself, 50,000 are dead. So for those that don't come out and die from the process, are they fine?
You better be born cesarean then.
Not necessarily. Have you ever seen a cesarean death before? Cesarean birth before? It's actually pretty traumatic. It's almost even worse than vaginal. They do a lot of pulling. Oh yeah, they got a slit and it's fighting and the muscle spasm. It's pretty bad. But anyway, so we adjust kids, we check kids, and we adjust them on a regular basis. And that might sound foreign to some people, but it's so natural to me. They did a study in Germany, and they wanted to find out how many kids were subluxated at birth. Well, they took 2,000 kids born just at birth, and they checked them. And according to their diagnostic criteria, between 80 and 90% of them were subluxated at birth. 80 to 90%. And they didn't base it on neck pain or back pain. They were just checking, and they found this out. And they adjusted them. And it was a great study. They show how a lot of them got better for these variety of ailments and that kind of thing. But anyway, so if you're born, I think you're qualified to get checked by a chiropractor. I mean, if we have spines. Unless you're a jellyfish, then don't apply. Okay, now moving on. Physical stress is huge. What else do we have? What other kind of stress can cause subluxation? Chemical. Did you say that? You said chemical? This guy is so smart. Why did you say that? Why chemical? What do you mean?
With some of the prescription drugs like you talked about before, if you have a kind of reaction to one of them, there's some chemical stress that might occur within your body.
Absolutely. So chemical stress, all the drugs we just talked about, all these stats right here, is that a subluxation inducer? You bet it is. Chemically, it will cause subluxation. What's the third one? One last one I'm looking for. Gosh, no, only one person is ever, two people. What's that?
Psychological.
Mental stress. Good. I think you missed your calling. You should have been a chiropractor. Mental stress. All right. Mental stress. Does that make sense, guys, how mental stress can cause subluxation? Can you see that? Okay. Let me just give you an example. Anybody ever have road rage in here? She's pointing the finger. You're a road rager?
Yes, he is.
All right. So, okay.
Drove only about 3 million miles in my lifetime, and the way some people drive.
Is that right?
I'll let you leave the parking lot first.
Stay out of his way. So road rage, guys, here's what happens. You're driving down the road, and all of a sudden someone cuts you off. And immediately, your brain gets this surge of energy. Okay? And that energy has to go somewhere, because that's a lot of mental stress. And where does that energy go? Right down the spinal cord, right out those nerves, and right into every single cell and organ and tissue in your body. And what happens? Your heart rate increases, your blood pressure increases, your breathing becomes shallow and more rapid, you start to sweat, your muscles become tight. It totally changes your physiology, stress does. So for those that have some kind of chronic stressor in their life, they're getting chronic subluxation. And some people carry this stress right up here. And some people might carry it in their wrist, and some people might be in their back, or some people in their jaw, but people carry stress in their neck. I mean, it depends on the person. But if you're chronically having that stress, and those muscles, because think about it, those nerves go right out the spine. These nerves go right out the spine, and they control all the muscles around that spine. And if those muscles become tight because of all that stress, it's going to pull out that vertebra even more. And that pulled out vertebra will put more pressure on that nerve, causing more muscle tightness, causing more pressure on the nerve. You get this vicious cycle. And subluxation occurs. And so chiropractic goes in there and we break that up, we break that cycle and reduce the stress and the pressure on the nerve and the spasm. Okay, so guys, all these things are what cause subluxation right here. So the game is that you can't, well, let's go there in a second, but I want to ask the next question. How do you fix a subluxation? If you can't do this one, then you just got to leave tonight.
Chiropractic.
You go to the chiropractor, that's right. And you pass. So we adjust the spine. And by the way, how many adjustments does it take to fix a subluxation? What's that process? One? Depends. It's a good answer.
I imagine everybody's different in that aspect.
Everyone's very different. Let me give you an example. If I get a baby in here, has anybody ever seen a baby adjust in here before? A baby? Okay. Well, I adjust babies. And if babies come in, and gosh, who's my last kid that I saw here? Trying to think of an example. Okay, a little kid named Mitchell. Mitchell comes in, and this kid is well, no, he's 2 years old. Okay, a little guy named Mason that I saw. His first stop on the way home from the hospital was right here. He was born. 24 hours later, he was in my office getting checked. Why? Was he hurting? No. Neck pain? No. But his parents were well educated on chiropractic and just wanted to get him checked to make sure he was subluxation free. So they brought him in and I checked him, and sure enough, a little subluxation in there. And so I get my hands on him and I set up on him, and then boom! I just give him a nice thrust up in that neck. I'm just kidding, Scott. Scott's like, he's got kids, he's horrified. I'm just kidding. It's not like that at all. But what happens is you get
with claims.
I'm joshing. So I got my hand on the vertebra, and I put a little counter pressure on the head, and I held it for a few seconds. It didn't take long for it to go right back into place, and that was it. Some pressure in the right direction. You can feel it move. That's right. And so we then checked him about a week later, and he was fine. It took one adjustment to fix this kid's subluxation. Well, why? The subluxation was probably there for 24 hours. It didn't develop scar tissue, and the muscle didn't memorize.
Plus, you don't have as much muscle mass.
There's not as much mass.
Work against you.
That's right. So in other words, the spine is not a standalone organ. It's just not a bunch of bones. But what happens is you got muscles that surround there. And so if you're like this for 20 years, the muscle becomes short over here, longer over here, and it memorizes that spot. And you also get scar tissue develops around that. The ligaments, tendons, everything just stays, it develops that way. And so when I adjust you, it's a misconception that you go from here to there. What really happens is that you go from here to there, and then by memory it wants to go back again, and I adjust it again, it wants to go back and again. And over time, with the right frequency, it will stay. And that's why maintaining frequency in chiropractic is so important, because we're trying to gain momentum on it and get it to fix. But in the case of that infant, though, one adjustment, and that was all it took, and it held very nicely. But in the case of someone who's, 35 years old-ish, what's going to happen? Did I overshoot or undershoot on you?
No, undershoot.
I undershot? Okay, good. So if you're 35 years old, it might take a whole lot longer to get everything to retrain. So it varies. It could take 6 months, it could take 1 day. So that's how you fix subluxation. And by the way, once it's all corrected and you're ready to go, then what happens? Are you done with chiropractic care? No? What do you mean?
You need to strengthen the muscles to keep them.
Okay, you got to strengthen the muscles. You got to maintain. Maintenance is a good word. So what happens is that maintenance, wellness care. Once you're all fixed and corrected, we then recommend you come in on a wellness, on a maintenance basis. And for some people, that might mean once a month. Sometimes it might mean twice a month. It just kind of depends on how you hold your stress and what's going on in your life that's going to perpetuate subluxation. Now, every time I say this in this portion of the class, there's always someone that's thinking, I knew it. They told me that once you go to the chiropractor, you got to go for the rest of your life, and I was right. I was right, and they're upset about it. And my response is, well, okay. But here's the deal, is that I'm also a lifetime dental patient. I'm sold on the concept of oral hygiene. As long as I have teeth, I'm brushing, I'm going to floss, I'm getting my 6 months checkups because I'm eating sugar, I'm chewing ice cubes, and I'm using my teeth. And I got to take care of them. Well, the thing is that we're all aware of our teeth because we're smiling and we're kissing people and we got to smell it. And so we're taking care of it, we're maintaining it. But our spine gets forgotten once the pain's gone because we're not aware of it. We're not seeing it. We can't smell it. You just don't know that it's rotten, per se. But so anyway, as long as you're living life and you have physical stress and chemical stress and mental stress, even if we get you strengthened and stable, you still have a need to maintain your spine. And so I think that wellness maintenance care is a great idea. Just like I think that exercising, getting a regular haircut, and taking showers is a good idea. You got to maintain things. Here's the interesting stat. They found that they did a study on men, wanted to find out how good men were at taking care of their health. So they compared the amount of money they spent each year on maintaining their trucks and compared to how much money they spent on maintaining their health. And they spent more money maintaining their trucks, getting their oil changed and the tune-ups than they did on their own health. Anyway, but here's one of the best studies I've seen on maintenance chiropractic care, folks. They They took several thousand patients that were getting chiropractic care, and to qualify for the study, they had to be getting wellness chiropractic care. Not what you get. You guys are all pretty new patients, but we're talking once-a-month adjustments. They'd been doing that for 5 years or longer. They took this group of people and they compared their health care cost to those that weren't getting chiropractic care. And what they found was that the chiropractic group had spent 70% less on health care overall. Cut their expenses by 70% than those that weren't getting chiropractic. They also had 56% less medical doctor visits. They had 70-something% less prescription drug use. I mean, across the board, a healthier group because they're maintaining their health. So there's, even though it's just well worth it. So guys, here's the deal. I got a few minutes left. I want to talk about what chiropractic really is. People have this image that chiropractic is about back pain or my arm numbness or my headaches or something like that. But in reality, chiropractic didn't begin that way, and it was never intended to be that way. In fact, who knows what the first chiropractic patient had? Have you guys heard this story before? Do you know, Scott, you're kind of a smart guy. You don't know what he had?
What's his name?
What's that?
What was his name? The school was based off.
Palmer, D.D. Palmer, yeah.
18 something.
1895.
First adjustment.
Yeah.
September 18th.
Did you do some research or something like that?
Birthday. I remember this stuff.
That's great. Did you go to the website and look up these things?
Yeah, it was in your book. And
Okay, good. Okay, good man.
see what you can look forward to.
So yeah, back in 1895, Dr. D.D. Palmer had a patient come in who was deaf. And he says, well, he examined the guy and just went on a hunch and found a misalignment in his spine in his physical exam and said, I'm just going to adjust your spine and we're going to see what happens. Well, he adjusted this guy and his hearing was restored. I mean, that's what it took. And he thought that he stumbled upon the hearing cure. So he started advertising all over the nation, come get the chiropractic hearing cure. And people were coming and people weren't really getting better. A few did, but what he noticed in his work was that people were starting to show other areas of health improvement. And he was realizing that he was removing nerve interference, and the nerves control all these things. And as you release that nerve pressure, people get healthier. And that was the birth of our profession. And then he created a school, and 110 years later, here we are. So it's so much more than just back pain, neck pain, that kind of stuff. It's really about keeping you at optimum health by keeping that brain-body connection optimized. Therefore, your cells and you are optimized. What was that? Stretching your mouth?
Yeah.
That's funny. Sorry. That was great. Anyway, so that's what chiropractic is. So I got some studies up here I want to show you guys, just to kind of expand your understanding a little bit about what we can do. Let's see. I'm going to skip some things and just make it real easy here. Yeah. Okay. Colic. Who knows what colic is? Infantile colic.
I had 3 kids with it.
No wonder you're so bitter. No, I'm just kidding. You had 3 colicky kids?
Oh, the first one, he's 42 years old now, but he was horrible when he was
Man.
infant.
That's tough.
6 months, I suppose.
Yeah, okay. So colic, for you younger folks, you don't know what it is, do you?
She didn't sleep for the first couple of years.
Colic is a condition that infants get where they're crying unconsolably for hours at a time. We don't know exactly what it is. There's theories that it's abdominal distress, maybe because of gas, but they really don't know. It's just a guess because of the way they cry and they hold themselves and the way they're comforted. But anyway, the studies show that 94% of the people of the cases where kids are getting chiropractic care for colic, they respond beautifully. That's right. I haven't had a kid yet in my practice that hasn't responded to chiropractic care when they have colic. It's very effective.
See, these kids are all born real small, like 4 pounds, 6 ounces. Something they said
Just little guys.
Internal organs weren't developed.
Is that right?
Yeah.
Okay. So there could be different reasons for colic, but 94% of the case, according to research, respond well. My son, I was in chiropractic school, and my son Sam, right in the middle of finals, was born. And he would wake up, actually right before finals, and he was colicky during finals. And right in the middle of the night, he'd wake up, I don't know, 1 o'clock in the morning, and he would he would scream bloody murder, as if, and so my wife and I would take shifts, and so I'd go out there and I'd console him, and there's not much you could do, but he just screams. And I'd wake her up, she'd take a shift, and I'd go back to bed. And it was very, very stressful on us. He would cry for hours. And then finally, around 4 o'clock, he'd go to sleep. And we're just tired and time to go to school pretty soon. So it was very stressful. We tried Herbs. We tried rubbing his ileocecal valve to get the air moving. We tried all kinds. I finally went to the pediatric professor at our school, and I hadn't had the class yet. And by the way, he was a medical doctor, and I said, what can I do for my son? And he says, well, have you had him adjusted yet? And I was like, oh. Like, here I am, a chiropractic student. That didn't even occur to me because I'm like the rest of society. You're looking for outside solutions and not for inside possibilities. So I take him to a chiropractor who sees a lot of kids, and he adjusted my kid. Scared me to death. I knew he was going to break his neck, but he didn't. He was fine. And my son that night slept 70% better. It was awesome. We got him checked a week later, and he adjusted a second time. After that, it was gone. Took 2 adjustments. In fact, the research shows, if you read this further, it shows that it takes an average of 2 to 3 adjustments before they respond. I mean, kids, beautiful response.
What, did they have a pinched nerve or something then?
That's right.
Causes that
It could be. A lot of people will have pinched nerves in their mid-back or even their neck that affects the nerves that go into the stomach, and the stomach can act up. I got a lot of patients, not just infants, that respond to stomach problems, to heartburn, to constipation, to bloating, to gas. If you look through my testimony, you'll see stories like this, where people get adjusted and those things just clear up. So yeah.
makes sense, though, I guess.
It does. And the thing is that medicine is they're not looking for an inside solution. What interest do they have in referring you to a chiropractor? I hate to say it that way. It's basically about chemical solutions for better health. And they don't look beyond pharmacological solutions for better health for the most part. But okay, so moving on. Let's see. Blood pressure. Study shows that when you get adjusted, your blood pressure goes down. They compared 2 groups. One group had real adjustments. One group had fake adjustments. It's called placebo control. And what they found was that the actually adjusted group had a significant decrease in blood pressure versus those that didn't get the chiropractic. Ulcers. Okay, this is an interesting study. They basically wanted to compare groups. They took a medical group of ulcer patients and a chiropractic group of ulcer patients, and they took a picture of the ulcer. It's called an endoscopic exam. They go down there and take a picture of before and after. And what they found was that the chiropractic group got better an average of 10 days earlier than the medical group did, without drugs, just adjusting the spine. And by the way, let's stop here for a second. A very important point is this. Are the chiropractors curing the ulcers and the blood pressure and the colic and these kinds of things?
They're helping the body to do it itself.
You got it. So chiropractors are not healing things or curing things. Chiropractors remove the nerve interference and allow the body to heal itself better. The body is a self-healing, self-regulating organism. It knows how to. You just need to allow it to and encourage it and give it an environment whereby it can heal better. So that's right. Moving on, dysmenorrhea. This is painful menstruation. I've only had one patient in the history of my career so far who has dysmenorrhea or painful menstruation that hasn't responded. Most of them do. They get less. I mean, some girls get it really bad. So it's very effective. Moving on, HIV. Ooh, that's a politically heated one right there. Now, guys, I put this up here to make some points. Now, this is very interesting. What they did in this study is they took a group of chiropractic patients, a group of HIV patients. Everyone know what HIV is? It's basically a virus that attacks your immune cells, and it kills them off so eventually you can no longer defend yourself. And you don't necessarily die from AIDS, but once those immune cells get below a certain level and you can't defend yourself, you die from something trivial like the flu or pneumonia or something like that you shouldn't have gotten in the first place. It's immune suppression. So over a 6-month period, they divided these 2 groups up, and one of the groups got chiropractic care, and the other group got placebo. They got a fake adjustment over this 6 months. And what they found was that, well, I got to back up a second. There's a certain cell called CD4, and CD4 counts is the gold standard by which you track the progress of HIV. And when it gets below a certain level, like I said, then you have AIDS. And so over a 6-month period, the non-adjusted group had about an 8% decrease in their CD4 counts. That's normal. That's what was supposed to happen. Now, the adjusted group had a 48% increase in their CD4 counts. They actually got more immune response and they had HIV over 6 months. It was a phenomenal study. This study had so much impact that in 2 states they changed their laws concerning chiropractic. And one of them was in Delaware. And in Delaware, if you have HIV, you qualify for state-funded chiropractic care. They'll actually pay for it because it's one of the few natural things shown to boost immunity while you have HIV. Now, I bring this up not because I want you to run out and bring all your HIV friends in. I mean, if you got them, great. But what I'm saying is that one of the very common things that happens to our patients is they notice they don't get sick as much. They have more immune competence. Again, you look at my testimonials, you'll see this said over and over. I have one patient who has a disease called sarcoid. Complicated, don't want to explain it, but one of the side effects of this disease is that you have very severe immune suppression. She gets sick all the time. About 3 or 4 times a year, she would be hospitalized during the wintertime. And she'd be in the hospital almost half the winter, like weeks at a time, because she couldn't breathe because she'd get so sick. She started coming in here several years ago, and she came in for neck pain. I said, you know what? After taking her health history, I said, your neck pain is one thing, but I'm concerned about everything else. And one thing you might be able to look forward to is getting sick less often. And she was like, oh, that'd be neat. Well, long story short, she hasn't been hospitalized in over 2.5 years since she started getting chiropractic care. She no longer gets that sick anymore. It's been awesome. But just one of those things. So guys, I could go on and on. But I'm trying to make a couple points. And here's the main thing, is that health care is not something that you only do when you break down, you're sick, and you run to the doctor. It's not living your life as crappy as you want, being sedentary, eating bad foods, not exercising, not taking care of your health. And then when you break down, you go and you get pills and surgery. Okay? That's what most of America is actually doing. And they think that's health care, and it's not. Health care is it's a lifestyle. It's a series of choices. Health care means eating right. It means exercising. It's choices that you make. It's choosing to get better sleep. It's choosing to have a better attitude. It's having good positive mental input. And it also includes taking care of your spine and your nervous system. And all these things create an internal environment whereby health can occur at a very high level. And if you do these things, you're not going to be sick. You're not going to have cancer, you're not going to have heart disease. I mean, this is what creates health. I shouldn't say you're not going to have these things, but your chances of breaking down and getting sick are significantly decreased by choosing a better lifestyle. And that's what health is. And so healthcare, it ain't up to me. It ain't up to St. Luke's. It's up to you guys. It's just choices. So that's what I want you guys to take home tonight. I want to end the class just by telling a couple stories. One of them was why I decided to become a chiropractor. I was in Japan several years ago, and I would be walking down the street, minding my own business, and it felt like I just got kicked right between the legs. And guys know that when you get kicked between the legs, it doesn't just hurt in your groin area, but it hurts in your lower. It hurts down here, right? And gosh, it hurt. And I'd be again doubled over in pain. It would hurt for like 5 or 10 minutes, and all of a sudden the pain would go away, and I'd jump up and think, gosh, is a ghost following around kicking me? What was that all about? And I'd be on my way again. And then the next day I'd be eating my breakfast, and boom, it would happen again. And it wasn't just pain attacks, but my testicles, we're adults here, except for you. Well, you're almost an adult. But they would actually swell up and turn red, and it was very painful. Well, this happened once a week and then twice a week and pretty soon multiple times a day. And I finally went and consulted, being the typical guy that took me 6 months to go see someone. I went and consulted a doctor. And he did an exam on me, and he said, okay, you have what we call recurring testicular torsion. And we got a surgical procedure for that. And he described his procedure. And I said, no, thanks. Surgery doesn't sound too good right now, and I left. And weeks later, I went and got a second opinion. And the second doctor said, no, you have something called varicocele testy. And we got this great procedure. We're going to remove these veins and put these ones over here. And he described this horrific procedure. And I wasn't game for that. I said, no, thanks. And I was scared. I was legitimately scared for the future of my kids. And gosh, it's a scary prospect. So I finally went to the Kobe University Hospital, which was the best hospital in the whole Kansai area. And they had all my records transferred over, and they kind of knew my case. And they had 3 specialists come in the room, and they all did different exams on me. And they went out and they left, and they came back, and they said, okay, here's what we got. We're going to do both surgeries just for good measure, just to make sure we got it. I know. I was like, no, you're not. Like, I was really, at this point is when I was really starting to sweat. I was like, man, I don't know what's going on. I felt very uncomfortable. It didn't sit well with me at all. Something didn't feel right. So I respectfully said, I'll think about it, and I left. And I went and I consulted a friend and said, man, I don't know what to do. And he says, well, tell me what's happening. And I said, well, I got this pain. It goes down here, comes up here, and it kind of comes around. He says, so it's in your back? And I said, well, no, not really. I mean, it's kind of, but it's mostly down. He says, well, why don't you try a chiropractor? Now, I was a pre-med student at the time, And I said, a chiropractor, why would I want to see a chiropractor? And he says, well, you know what, I've got some good experiences, and you've got nothing to lose, might as well try it and see what happens. And I said, you're right, I've got nothing to lose, and hopefully everything to gain if it does work. And so I reluctantly went to the chiropractor. And the chiropractor did an exam on me, and it was a very different exam. And the exam, it was a very nice exam. And in the exam, when it was all done, he showed me a poster of a spine and circled this part in my lower mid-back and explained that I have something called hazure. And in Japanese, in English that means subluxation. And said that the nerves that are being irritated by this misalignment happen to be the same nerves that control the male genitalia. And he thinks there's a referral pattern. And like the light came on. I was like, that makes sense. Like nothing else but that makes sense. And so I said, great, let's do it. So he adjusted me. And I was nervous and scared and sweating, but the adjustment felt great. And that day I went home and I was waiting and waiting for the pain to come. And it just never came. And the next day I was still waiting for it to come and it never came. Well, Wednesday came along and I went for my second adjustment. I was all excited. And I continued to do what he recommended 3 times a week. And anyway, it was about the third week or so where I was noticing that and by the way, the pain never came back ever since. To this day, I'm fine. But about the third week or so, I noticed that I wasn't taking my inhaler anymore for my asthma. I'd use it 3 times a day to stay clear. My allergy medication, wasn't taking that anymore. And I went to the chiropractor. I said, this may sound kind of strange, but since I've been coming here, my asthma, my allergies are clearing up. He says, oh yeah, happens all the time. I'm like, really? Well, what do you mean? He says, well, chiropractic is based on this principle. And it basically explained what I was telling you guys tonight. And it was an amazing experience for me because it not only prevented me from having something that was unnecessary, that potentially could have had some pretty wrong side effects.
They had 2 surgeries and been broke, too.
And been broke, I know. But not only that happened, my health was better overall, and it worked so well for me that, long story short, I decided at that moment that I want to be a chiropractor. I kept my pre-med major, and as soon as I finished school, I went right into chiropractic school, and it's just been a great decision. And I love to do what I do. And I love to do what I do because we get to see such good results. And I can think right now of a dozen cases of just excellent results. One of the things that stand out, I got a little girl. Her parents came to my class about 1.5 years ago, and they were getting good results with their problems. And they have this little girl who is 5 years old. And she has what's called kidney reflux disease. Okay, anyone know what that is? It's basically a disease that if you don't outgrow by the time you're about 3 years old, you're pretty much going to have it for the rest of your life. And they don't live long because they get chronic infections, and they have to give them a chronic stream of antibiotics. And without the chronic antibiotics, you're going to get infection and die. It's a horrible thing, but these people generally don't live past 30. So this girl was 5 years old, and the mom, after the class, says, can you help my daughter? She's got kidney disease. And I'm saying, whoa, whoa, whoa. I don't cure kidney disease, but I can check her for subluxation, and let's just see what happens from there. So she says, yeah, let's try it. So she brings her in, and we check this kid, and sure enough, she has subluxation. And I say, great, let's adjust her. And we outline a course of care. And it was about a 6-week course of care. And 6 weeks were over, and we re-examined her, and her nervous system looks great. Her spine's nice and aligned. I said, Mom, she's doing good. There's not much more I can do for her. Let's put her on maintenance now. I said, by the way, how's her kidneys doing? And she goes, I don't know. We haven't gotten them checked yet, but we're going to get it checked in 2 weeks. We get them checked every quarter to see how she's doing and adjust the medications and that kind of thing. So great. So about 2 weeks later, I'm back here adjusting patients, and I look over, and I see her walking in, and she's just beaming, smiling. Well, something's going on up there. So she comes up, and I say, so what's going on? She goes, we got her kidneys checked. Reflux is gone. I says, really? She goes, yeah. They took her off antibiotics for the first time of her entire life. She's not on antibiotics anymore. I said, that's wonderful. Well, that was 1.5 years ago, and to this day, this kid comes in free of antibiotics. Her reflux is gone, and she's functioning well. She's a very happy, vibrant little girl. And now her little sister, Faith, gets adjusted, and she's like 2.5. And anyway, but it's great. And Faith has nothing wrong with her, but we're just making sure that she stays healthy. Oh, but actually her nose cleared up after she started getting adjusted. She used to have a chronic runny nose. Anyway, but I continue to do what I do because we get to see these kind of results. If this kid hadn't had seen me, what would have been the result with antibiotics for that long a period of time? I just feel like we're affecting lives in a much greater way than just back pain and neck pain. And that motivates me to do these kind of things and educate you guys and to do what I do. But anyway, Guys, I've taken up enough of your time. Went over about 5 minutes, and I apologize. I want you to know that if there's one thing you learned from the class, it's that I want you to trust your body to heal more often, interfere less often with drugs, and make these choices that will help you to become healthier from within, to express that innate intelligence, and that is getting adjusted and staying adjusted, and it means exercising, eating right, sleeping right, and thinking right. And that's pretty much it. By the way, guys, all you guys during your first re-exam will get a little gift of health to give to a friend, and we really encourage that. There's so many people out there that just don't know about the benefits of chiropractic. I wouldn't have known if a friend didn't tell me. And half our patients that are here because a friend told them, well, go try my chiropractor. We're very much referral-based practice, and we appreciate referrals. If you know somebody in California, refer them to tell me, and I can find them a good chiropractor. If they're here, then we will offer your friends a chance to come in for a no-charge evaluation to see if we can help them out. Or if it's a family member or a neighbor or coworker or anything, we're glad to help them out. And we do have, I don't think I have any on me right now, a little gift of health. If you guys want, on the way out, you can talk to the front desk, and you can take one of those and give it to a friend and let them come in for that free consultation.